Hi guys. So I'm here to talk to you about what should be the strategy for all the exams which are all round the corner now. We have INICT which is coming up in November, we have FMG lined up in December, and then we have NEET somewhere around January, although there's been no formal announcement yet and we are waiting for it. But I would advise you guys to start preparing as if it's going to be in January, right? So what do you do at this point of time? So the last leg, which is this time of the preparation, is when you really hammer it on, right? So this is when you really need to pull up your socks and give it the speed that it requires. It has to be very high yield, it has to be very crisp, and it has to be very smart, right? So that is something which is extremely important, that this is not the time that you start reading subjects cover to cover. Now only the most valuable information needs to go in your mind, because remember this, in general, information subjects are never going to be the limiting factor. Time is going to be the limiting factor, your brain capacity is going to be the limiting factor, right? So we have to choose the right things that need to go into your brain at this point, because there are two kinds of things which any entrance exam is going to test. One is going to be your concepts and your clinical acumen in general, which is going to be say 30% of the exam, and the rest 70% unfortunately is going to be facts, right? It's going to revolve around facts, even though we can integrate them and ask them in a clinical vignette manner, but end of the day they're going to revolve around medical facts that you have to remember. There's no going around it. All right, so how do we go about it? So the conceptual aspect of things is something that you would have developed, you would have absorbed it in the process of your preparation. The facts is what we want to focus on in this final leg, because those come as direct replication of the knowledge that you have, right? So that is something that is going to be directly proportional to how well you have revised, and that is where the key, the cliched word, which is revision, comes in, right? So that is something which I want to focus on, that what is it that you revise at this point is going to be something which is very important. So now, because it's a daunting task, right? What if I'm not doing the right thing? And especially with so many resources which are available at your disposal these days, there is a very real FOMO which is there amidst all the students, that what if I'm not doing the right kind of things? So that is the whole concept behind Cerebellum in general. It is a bunch of teachers who are coming together to help you out, find those topics which are actually important and which are worthy of revision in this final leg of preparation. So that is what is the aim behind Cerebellum Academy, that we come up with the important topics and we come up with the things that need to go into your brain at this point of time, which you need to revise over and over again. So this has obviously been curated by the best in the business, and so that you can trust basically that there's a very transparent process which is going on between the student and the teacher, and there's nothing intermediate in between, right? There's always going to be an open chain of communication. So with this background, basically I am very eager and looking forward to seeing you all on Cerebellum in Delhi and in Bombay with the upcoming courses. So stay tuned and see you all very soon, and hopefully we will give you the right kind of information, the right kind of stuff that needs to be revised, and that would be very helpful in your journey. So that's the aim, and all the best to you. See you all soon.